Hi, welcome all to watch this video. I hope you all had seen previous video of sexually transmitted diseases. In this video, I would like to talk about one of the sexually transmitted disease, AIDS. AIDS is acquired immunodeficiency syndrome. Syndrome means a group of symptoms, or we can say AIDS means deficiency of immune system which is acquired during the lifetime of an individual. It is not a congenital disease, that is, not from birth. It was first reported in USA in 1981. Around 25 million people died in whole world due to AIDS. More than 1 million cases per year reported in India. Now let us see what is the causative organism of AIDS. AIDS is caused by human immunodeficiency virus, HIV. HIV belongs to the group of retrovirus. It has two strands of RNA genome enclosed in an envelope. Enzyme reverse transcriptase, protein P15 associated with genomic RNA, inner covering of P24 and outer covering of P18. Genome has both overlapping genes and split genes. 8 genes in HIV-1 and 9 genes in HIV-2. The envelope has spikes containing protein components complementary to CD4 or T4 antigen receptor present on surface of helper T cells, monocytes, macrophages and some nerve cells. Next, we are going to see how HIV is transmitting. There are 3 routes of transmission for HIV. Parenteral route is the first one. It is through blood contact involving unscreened transfusion of blood, tattooing, infected razors of barbers, poorly sterilized dental instruments, sharing of injection needles, and organ transplant. Second, through sexual route. It accounts for 85% of HIV infection due to multiple sex partners, prostitutes, homosexuality, and artificial insemination. Virus is present in sufficient strength in semen and vaginal secretions of infected person. The third one is transplacental route. Infection can occur from infected mother to fetus across placenta. It is called vertical transmission, and to infants through many misconceptions related with AIDS. AIDS does not spread through mosquito bites, hugging, kissing, sharing meals, toilets, towels, or utensils, shaking hands, coughing, sneezing, or looking after AIDS patients. So, AIDS infected persons are not isolated from family and society. There are high risk individuals, those having multiple sexual partners, drug addicts taking drugs intravenously, individuals who require repeated blood transfusions, children born to an HIV infected mother. All those people are high risk individuals. Now let us see how can we diagnose HIV. HIV is done by enzyme linked immunosorbent assay or ELISA test or Western blot test or PCR test, polymerase chain reaction test. Western blotting test is used for confirmation of ELISA positive cases, that is, testing of antibodies against HIV proteins. There are 3 stages for the symptoms of HIV. First stage, rapid weight loss, recurring fever, extreme tiredness, prolonged swelling of the lymph glands, in the armpits, groin, or neck, diarrhea that lasts for more than 1 week, sores of the mouth, anus, or genitals, pneumonia, recurrent infections, headache, skin rash, dry cough, loss of appetite, nausea, vomiting, difficulty in swallowing, ulcers or white tongue, yeast infections in mouth, throat, or vagina, purplish spot on the skin that don't go away. Let us see second stage of HIV infection. In human body, CD4 T cells or helper T cells coordinate immune system response. During second stage, HIV will kill helper T cells and destroy immune system and other infections will get. Third stage, AIDS is the advanced stage of HIV infection. This is when CD4 T cells or helper T cells number drops below 200 and immune system of the body is badly damaged. This leads to certain other diseases such as Kaposi's sarcoma, a form of skin cancer, and pneumonia, tuberculosis, a lung disease. They are considered as AIDS defining illnesses. About half of the people with HIV develop AIDS within 10 years. HIV antibody test is the best method to identify the disease. HIV spreads only through body fluids. HIV does not spread by mere touch or physical contacts. Hence, AIDS infected persons are not isolated from family and society. There is always a time lag between the infection and appearance, incubation period of AIDS symptoms. This period may vary from 6 months to 5 to 10 years. After getting into the body of a person, HIV virus enters the macrophages. Here, RNA is replicated to form viral DNA by enzyme reverse transcriptase. The viral DNA now gets incorporated into the host cell's DNA and directs the infected cells to produce viruses. The macrophages continue to produce virus particles and this way acts like HIV factory. The virus particles enter helper T lymphocytes, that is Th cells, in the blood where they continue to replicate and produce progeny viruses. The progeny viruses attack other helper T lymphocytes. Thus, the number of helper T lymphocytes progressively decreases in the body of the infected persons. During this period, the person suffers from fever, diarrhea, and weight loss. With the decrease in number of T cells, the immunity also decreases. The person is unable to produce any immune response even against common bacteria like Mycobacterium, parasite like Toxoplasma, viruses, and fungi. AIDS has no cure. However, use of certain drugs can prolong the life of AIDS patients. Antiretroviral drugs are only partially effective. Currently, 3 antiretroviral drugs are being used. It is called triple drug treatment. It consists of azidothymidine, a protease inhibitor, and an interleukin. The treatment is provided to all AIDS patients through 200 antiretroviral treatment centers or ART centers of NACO, NGO, and private hospitals. Prevention is the best option for AIDS. Many people are ignorant about AIDS and it has been said, don't die of ignorance. In our country, NACO, National AIDS Control Organization, and other NGOs, non-governmental organizations, are educating people about AIDS. Every year, December 1 is recalled as the World AIDS Day. It is one of the methods to educate people about AIDS. Screening is compulsorily carried out in case of all blood donors, organ donors, semen donors, sex workers, etc. Prevention of sexual contact and pregnancy in case of AIDS positive person. Ban on prostitution. Safer sex between single partners. Condom with coating of nanoxynol 9 and barrier cream, example dextrin sulfate, are effective in checking HIV transmission. Disposable needles, syringes, blood bags, and dialyzing sets should be used. Razors, blades, and dental equipment must be thoroughly sterilized. Free distribution of antiretroviral therapy ART to AIDS patients. Prophylactic dose of nevirapine tablets or syrup to babies born to HIV positive mothers. AIDS sign is red ribbon to give awareness to people. Thank you for watching this video. Subscribe and share the video. Give awareness about AIDS to families and friends.